Hey everyone, we're doing a medicine review. So we're doing diabetes mellitus today. Now diabetes mellitus is one of the most common diseases that we come so far. The acute manifestations include polydipsia, polyuria, polyphagia, which are like the 3 P's. Polydipsia means excessive thirst, excessive frequent urination, and then we have polyphagia, which is excessive hunger. Then we have weight loss, diabetic ketoacidosis type 1, hyperosmolar hyperglycemic state type 2. Rarely we have unopposed secretion of growth hormone and epinephrine, which is also seen in patients with glucocorticosteroid therapy, where people take glucocorticosteroids, we get the steroid diabetes. We also have the chronic complications. Number 1, there's non-enzymatic glycation, which is small vessel disease, hyaline arteriosclerosis, retinopathy, which is the retina, neuropathy is the neural tissue, and nephropathy, which is the kidney. The large vessel disease, atherosclerosis, of course, we have coronary artery disease, cerebrovascular disease, peripheral vascular disease, and myocardial infarction is still the most common cause of death in diabetes mellitus. Now, another chronic complication is osmotic damage, which is sorbitol accumulation in organs with aldose reductase and or decrease or absence sorbitol dehydrogenase. Then we have neuropathy. It could be motor, it could be sensory. Sensory has a glove and stocking distribution, and autonomic degeneration with GERD, gastroparesis, diabetic diarrhea. Also, chronic complication includes cataracts. Now, what are the diagnostic tests? We have HbA1c. The diagnostic cutoff is more than 6.5. It reflects the average blood glucose over prior 3 months influenced by RBC turnover. We have fasting plasma glucose, which is more than 126 milligram per deciliter, fasting for more than 8 hours. 2-hour oral glucose tolerance test, more than 200 milligram per deciliter, is basically after 2 hours of consumption of 75 grams of glucose in water. And the 4th test is random plasma glucose, which is more than 200 milligram per deciliter or equal to. Presence of hyperglycemic symptoms is required, which is obviously polydipsia, polyuria, polyphagia, weight loss. Those symptoms should be there with random plasma glucose. Random does not require fasting, of course. Alright, so the difference between type 1 and type 2 diabetes mellitus is simple. Type 1 has autoimmune T-cell mediated destruction of beta cells of the pancreas, and type 2 has increased resistance to insulin, progressive pancreatic beta cell failure. Alright, so therefore the insulin is always required in type 1 diabetes because the autoimmune disorder, so they don't produce any insulin, so we need outside human insulin, right, like human formed insulin. And then we have type 2 diabetes, which is sometimes you require insulin because the diabetes, the insulin resistance is very high and the sugars aren't controlled with medicines. Then you require insulin, but sometimes you don't need it, right? It is manageable with oral, hypoglycemic agents. Then we have the age. Age is usually less than 30 years. In certain cases, it is above 30 as well, but around 30 to 40 years of age. And type 2 diabetes is usually more than 40 years, alright? So 50s, 60s, it's a middle-aged disease. Now, obesity is usually not present in type 1 diabetes because it is autoimmune, but in type 2, obesity is there. Genetically, it is type 1 is relatively weak, 50% accordance in identical twins and polygenic. But relatively strong genetic in type 2, 90% concordance in identical twins, polygenic, alright? Now, HLA association, it is usually type 1 has HLA-DR4 and DR3 association, and there is no HLA association with type 2. The glucose intolerance is very severe in type 1, while it is mild to moderate in type 2. The insulin sensitivity is very high, while in type 2, it is about low. Ketoacidosis is very common. We are going to discuss that in type 1, but it's very rare in type 2, okay? Now, the beta cell numbers in islets of pancreas is usually decreased in type 1, but it is variable with amyloid deposits, all right, in type 2. And the serum insulin levels are usually decreased in type 1 diabetes, and initially they're increased in type 2 diabetes, but decreases in advanced diseases in type 2. Now, the manifestation of the symptoms, the common symptoms, polydipsia, polyuria, and polyphagia, they're very common in type 1 diabetes, but they are sometimes not present in type 2 and sometimes they're present, right? So we do have the histopathology pattern in type 1, which is islet leukocytic infiltrates. while in type 2 we have islet amyloid polypeptide deposit. So that is the difference. All right. So what is diabetic ketoacidosis? Now, the pathogenesis is that insulin non-compliance or increased requirements due to increased stress, for example, infection. Basically, it causes lipolysis and oxidation of free fatty acids, increased ketone bodies, beta-hydroxybutyrate acidosis, all right? And there's insulin deficient and ketones are present. Now, the signs and symptoms, we have diabetic ketoacidosis is deadly. We have delirium, psychosis, cusumal respiration, rapid deep breathing, abdominal pain, nausea, vomiting, dehydration, fruity breath, odor due to exhaled acetone. Now, what are the labs? Hyperglycemia, increased hydrogen ions, decreased biocarbonates, increased anion gap metabolic acidosis, increased blood and urine ketone levels, leukocytosis. There is normal to increased serum potassium, there's osmotic diuresis, and there is increased potassium loss and urine. There's also total body potassium depletion. Now, what are the complications? The life-threatening mucormycosis, cerebral edema, cardiac arrhythmias. And the treatment should be IV fluids, IV insulin to replete and potassium to replete the intracellular potassium levels. Glucose may be required to prevent hypoglycemia from insulin therapy. So that's about it. I am Dr. Sanamia Bhoy, and I'll be coming up with medicine-related topics every Monday and Wednesday. So please do like, share, and subscribe to my channel. Take care and goodbye.